Greetings and welcome to this edition of the Kokayi Academy for the Healing Arts. I'm your host, Dr. Kokayi, and welcome. Today I want to talk about perception, science, and homeopathy. In 1979, I had taken a year off from medical school. Why? Because I had a profound sense of a limitation in terms of what I was learning, that there had to be something more. So somewhere in the latter part of 1979, I found myself sitting in a homeopath's office. This was not a doctor of homeopathy. This was a lay homeopath. And at the time in this country, some of the best homeopaths were actually people, lay homeopaths. So there was a client there who had eczema, and she had very severe eczema. Her legs were swollen and they were weeping, just sticky, serosanguinous fluid, and clearly she was miserable. Based on his interpretation of her symptoms, and he had a small, what's called Materia Medica, which is basically, it's a book that looks at all the details of a particular remedy, of various remedies, and how they impact on the body, what symptoms they've been shown to actually help. And in this case, he came up with homeopathic mercury. That's right, mercury, that toxic element, based on not so much on her skin, but also some mental and emotional symptoms that she had. So, of course, I was curious to see how is this going to work, because at the time, homeopathy was probably high up on the quack watch, in terms of how people were looking at it. So what happened is 2 weeks later, she returned, and all the swelling was gone, the inflammation had cleared up, and it was her perception. She clearly related it to the impact of the remedy on her system. And I have to admit, I felt the same too after hearing her story and looking at her leg. And for me, that counted for more than anything that I could see from a quack watch or hear. I'm like, wait a second, there's something to this. So after a little bit more investigation, I decided I definitely want to master the art of homeopathy. Now, this is 79 going into 80. I'd taken this year off from medical school. I was looking at books like The Dancing Wooly Masters by Gary Zukov, The Tao of Physics by Friedrich Capra, and all of these books were redefining reality, redefining about how we look at the universe and what we consider real. So fundamental to this was the notion that classical physics is really just a small subset in a larger quantum reality, if you will. A larger reality that is beyond space-time, a larger reality that's beyond our ability to perceive with our five senses. And this was clearly being documented. Now, of course, Western medicine has a cultural imperative that causes it to focus more on our biochemical and our biophysical bodies. That's what's real. Within a larger quantum reality, there's room for much more. In fact, most of what actually is beyond what our five senses can actually pick up. Now, of course, what does this have to do with homeopathy and the practice of medicine? Well, actually, the other cultures tend to focus on different aspects of the larger electromagnetic spectrum. So, for instance, in Asian medicine, the focus is on the movement of qi, or life energy. And qi can be seen in everything from martial arts to food, to the qi of different organs and different parts of the body. Now, Europe has its own more esoteric traditions, or traditions that aren't linked in a biomechanical reality. Part of the difficulty that Western scientists have with homeopathy is that what you're actually giving a person no longer is in a milligram amount. In fact, the most remedies are prescribed at a level where there's not even a mole of the original chemical substance there. In other words, it's beyond Avogadro's number. There's not even a mole of the original substance. So, of course, within a biochemical model, this is placebo, whatever that means, right? But as science has evolved in terms of its ability to actually interface with the large electromagnetic spectrum, it's actually demonstrated that homeopathy, a homeopathic remedy, has an effect at a submolecular level. A submolecular level that now the technology exists to actually measure that. In other words, homeopathy is quote unquote real. Now, at the turn of the 19th century, we found that, actually, the 20th century actually, I'm going to say, in the 1900s, 25% of this country's physicians were homeopaths. This was in the early 1900s. But with the Flexner Report, which was orchestrated by the pharmaceutical companies and big business interests, it was said that homeopathy is not scientific. So homeopathic universities no longer received financial assistance from the federal government. There was Flower and Fifth Avenue Hospital here in New York that was largely homeopathic. Hahnemann University in Philadelphia. In fact, Samuel Hahnemann, the founder, the original, well, I won't say the originator, but the person that actually took advantage of the quality of things that allows you to capture the energy of the substance, right? We actually have his picture, we have a statue of him in Washington, D.C., right? So he was acknowledged as a genius in this field in terms of what he was able to come up with. So imagine that you can take any plant substance, or what's actually done, any substance in the periodic table, and prepare it homeopathically, meaning that you go through a series of dilutions that actually allow you then to really trap the energetic essence of a particular substance, right? So we're literally prescribing the energetic or the vital force of a plant, of a mineral. And the way that we decide how a homeopathic remedy works is that we test it on healthy people. So when I was doing some training in the UK, we tested the substance germanium. And the way that works is that you have people that were doing what's called a proving. And in that proving, a number of people are actually given a homeopathic remedy. And then the actual symptoms they develop physically, mentally, and emotionally are recorded. And then that recording is compared with all these individuals that are involved with the proving, and you begin to see the essence of that particular remedy come through. And that essence forms what's called a materia medica. Because within that materia medica, now when I have a patient, a client that comes in and they have a particular set of symptoms, I know that in homeopathy, likes cure likes, because I'm giving a vibratory medicine. And in giving that, I'm trying to see, does this person have a set of symptoms that span physical, mental, emotional aberrations? Does it cover all of that? Sometimes it might only cover part of that, but I can decide to actually prescribe that. So the way that it works, it's more like it's a wave that cancels out that illness, which is a reflection of another kind of vibratory pattern. I think that's fascinating. And what happens is we try to explain things within a framework that we're comfortable with. But we can't do that because classical physics and all the biochemical, biomechanical medicine that's come out of that, it can't explain that. In the same way that that particular model really isn't useful for treating different characterological problems, anxieties, depressions, different aberrations of the mind, different behavioral patterns. You're going to find that homeopathy has a real strength in that. I can't tell you how many patients I've helped with, let's say, a poison mushroom, Agaricus muscaricus, that has symptoms of panic attacks, anxiety, right? I've helped many people with that. Or even simple things. I had a patient from bronchitis to my own son was having respiratory difficulty going into asthma. A remedy called antimonium tartaricum actually cleared that up within a few hours, and none of the symptoms progressed, right? Any number of things from attention deficit, but particularly where you can see the mind-body connection. Right now, there's a lot of work being done in homeopathy in terms of being able to prescribe for more physical complaints, right? Where you're really looking at a physical pathology where there's an aberration in the person's vital force that's more localized as opposed to the whole process. There's so many things that can be said about homeopathy. There's tons of research going on. And just imagine different plant kingdoms are being mapped out in terms of the energetic vibration that's actually covered by a particular species of plants. One of the things that I found most fascinating, I think there was a proving of granite, right, in an area that there's a lot of alcoholism, but there's a lot of that granite stone. And they found that that granite stone was, it had a lot of provings that dealt with cravings for alcohol. So what I'm saying then is that a lot of times when we take on illness, we're taking on the vibration of things that are around us, and that's distorting our own life energy. So I hope this gives you a little bit of a taste for what homeopathy is like. In the fall at City College, there's going to be an online course that I'm supervising where we're going to have about 20 different workshops to look at the full spectrum of integrative medicine, both including biomechanical, biochemical, bioenergetic, and spirit consciousness realities. You'll be hearing more about that. And thanks for joining me today. And remember that we are spiritual beings having a human experience. Blessings.